Public health officials have issued a broad health warning about eating meat sliced at any deli counter as they work to trace the source of a listeria outbreak that has killed at least 2 people and hospitalized at least 28 across a dozen states. The Centers for Disease Control and Prevention issued a notice Friday that said people over 65 have a weakened immune system or are pregnant should not eat deli counter sliced meat unless it was reheated to an internal temperature of 165 F or was steaming hot. The groups singled out by the CDC are especially vulnerable to severe listeria infections. Outbreak details. Cases tied to the outbreak range from people ages 32 to 94, with a median age of 74. The states with confirmed cases are Georgia, Illinois, Maryland, Massachusetts, Minnesota, Missouri, New Jersey, New York, North Carolina, Pennsylvania, Virginia, and Wisconsin. The true number of sick people may be higher than what has been reported, because it may take 3 to 4 weeks to determine whether a sick person is part of an outbreak, and some people recover without medical care. Advice for older adults. People who are pregnant, age 65 or older, or have a weakened immune system should avoid eating meat sliced at any deli counter unless they are reheated to an internal temperature of 165 degrees, or until steaming hot. Let the meat cool before consuming it, says the CDC. In addition to the guidance about reheating deli meat, the CDC advises people to clean your refrigerator, containers, and surfaces that may have touched the meats. If you experience symptoms of a listeria infection, contact your doctor right away, the CDC stated. If you are diagnosed with an infection, work with your local or state health officials to provide details about what you ate in the month before getting sick. Listeria monocytogenes, the bacteria responsible for listeriosis, is ubiquitous in the environment and can thrive in various conditions, including refrigerated temperatures, says Darren Detweiler, an associate professor at Northeastern University and a former FDA and USDA food safety advisor. Symptoms of a listeria infection. Listeria infections pose a severe threat to people 65 and older, who are 4 times as likely to be infected, according to the CDC. Symptoms associated with a listeria infection includes neck stiffness, confusion, loss of balance, convulsions, fever, muscle aches, and fatigue. Pregnant women usually experience only fever, fatigue, and muscle aches. However, listeriosis can lead to pregnancy loss or premature birth and can cause serious illness or death in newborns. Anyone who experiences symptoms of severe listeria illness should call their healthcare provider. About 1,600 people in the U.S. get listeriosis each year, with an average of 260 deaths, the CDC estimates.